Hey guys, so there's been an epidemic in my clinic this weekend, particularly in the last 2 weeks actually, of concussions and head injuries. And what I'm seeing is that a lot of people don't know that there are resources available to assist with concussion recovery. So I wanted to push this out to you guys because the mismanagement of this has led to one of my newest patients actually they've really suffered since October in dealing with this post-concussion syndrome symptoms. And what I see they're doing, and have only had a session or so of PT outside and didn't feel like they were getting what they need. So that's how they ended up in my hands. So after seeing kind of how it was managed in her case, I just really need to push this out, guys, because honestly, this has probably lingered a lot longer for her, and she's been suffering, not able to even get heart rate above 110 beats per minute without kicking off a ton of concussion syndrome symptoms. So, and this is really devastating because she's a student athlete, collegiate athlete in softball, unable to work out, unable to do kind of anything without really kicking off a ton of dizziness, visual kind of disruptions and these type of things. So what I really want you to know is that what we can do when we assess this in the early phase of this is we're looking at kind of gaze stabilization. How is the visual motor kind of reactivity looking like? How is the vestibular system? Is there any kind of cervical, like neck problems, whiplash related items that occurred with the injury that could be kind of masking themselves as a concussion? Are there things that we can do like the impact test where we do a computer-based testing to identify is there any kind of impulse control, reaction time, verbal memory, visual memory loss? This is stuff I've been doing for 10 years, guys, and there's so few people that actually treat it. You got to get in the hands of the people who have experience in dealing with some of this stuff. So if you've been suffering with concussion, know anybody who's dealing with concussion, we got to get them in, and we can shortcut and kind of get you to the finish line faster if we know, one, what's wrong, two, are there some parameters that we need to know to kind of intervene and shorten this overall recovery time? Because the stuff I'm seeing, even in other PT offices, that they're getting as far as homework and advice is triggering a lot of the post-concussive symptoms. So we've got to apply the appropriate force, apply the appropriate challenge to stimulate without irritating. So get in the right hands, hit us up at Form and Function. We're happy to help you with concussions, and I really hate to see people suffering like this, so I needed to put this video out for you guys.